interesting to me is the range of dosage.
Yes.
So it's one of the few medications where for the same thing in the same size patient, dosage may be 300 to sometimes 3,000 or 5,000 milligrams a day.
Yes.
Is that just, they're kind of just shotgunning to see if it does something, or is there a significant difference in the dosage for different treatment of different disorders?
No. The therapeutic dose, so the dose at which 50% of patients respond is 1,800 milligrams. But some people respond at much lower doses, and for some people, I've seen people on 5,000 as well. And it doesn't have to do it doesn't have anything to do with size. I've seen little people on 3,600 with very few side effects, and bigger people that have side effects at 300. So for me, the trick with gabapentin is to increase it very, very slowly so patients can get used to the side effects and you can bring them up to therapeutic doses. Because for me, a 300 milligram dose is probably not very effective. I mean, I haven't seen it very effective other than putting people to sleep at night, and so giving them better sleep at night, but that's not really the option. That's one of the advantages of Release, on paper at least, is that because you don't have these peaks and valleys, you can increase it to therapeutic dose much, much faster. Because you have to also consider that the patients are very impatient. They've been suffering from this disease for a very long time, and you tell them it's going to take them 3 months to get to therapeutic dose, and then after they get to therapeutic dose, they have to stay 2 months on the medication for me to evaluate whether the medication should be discontinued or further increased. So they don't really like that. They don't like the length of treatment. I mean, these medications don't work like Tylenol or ibuprofen. You have to take them for a long time before you can evaluate them. So sometimes I have patients who come in and they say, oh, I've tried this, tried that, tried that, tried that. And I say, how long have you been on these medications? Oh, 2 weeks, taken them twice. I mean, that's not a valid trial. You have to repeat the trial, and that also doesn't make them very happy. You have to repeat medications that they've already tried. So I have really great hopes for Release because of the side effect profile that will allow me to bring up the doses of the medication much faster. But again, it's a financial decision. You know, we do have samples of Release right now in the office, so it's really great. I can put patients on for a month for free. And because you can ramp it up much faster, maybe in a month I can see the trend. Because even at 1,800 milligrams, it's kind of like the break point. If they have some improvement, I bring them up. If they don't have anything, I just taper them down. So I'm going to also talk to you about treatments that are complementary alternatives that are around. And one of them is alpha-lipoic acid. And that's something that is found in the diet, but it's also something that is supposed to cure Lyme disease, cancer, you know, one of those overused type of substance that's supposed to treat everything. What it does basically is it improves vitamin status and apparently protects the epithelium. But if you look at this study, it's great. If you look at this study, it's not great. They're both double-blind studies. And on one of them, you had a lot of efficacy, like 93%. And this one did not find any difference between that and placebo. So should you use these medications to harvest the placebo effect at least, which is usually 20%? Well, then you have to consider the side effects and the possible risks of the therapy. So you have to eliminate people who have diabetes, thyroid disease, thiamine B1 deficiencies. It's a must. I mean, you cannot give them this type of supplement. You cannot give them to people who are on chemotherapy, taking antibiotics, taking anti-inflammatories, vasodilators. So you already are decreasing the population for whom this medication is safe. So it's up to you. I mean, you can try it at very, very small doses, see if you have results, and if you don't have, and keep monitoring the patients, of course, and always acting together with their primary care physician to see if it's okay for them to take this. because it's not just a nutritional supplement. When you see this at first, you say, Brussels sprouts, carrots, beets, I mean, it looks pretty reasonable. I mean, it looks pretty healthy. I think that it would be safe. And then when you look at this, then you probably have second thoughts. So for any kind of nutritional supplements that you give patients, you really have to be really, really careful. Topical sucralose is interesting because that's purely palliative, but it does work. So you can, because there have been really serious studies, one of them from a friend of mine, and he's a neurologist in Pennsylvania, and he put patients on gum, and as long as they're chewing the gum, the burning disappears. And I have done that in my practice with patients in the office. But of course, the minute they stop chewing the gum, it comes back. But it's still a lot of relief. Even if it's during the time when they're chewing the gum, it's valuable. And sucralose is not something that you cannot give to patients who are on other medications, so it's much, much safer. But again, you know, they have to know the limitations.
I have a question.
Yes.
Do you find that sometimes patients, once they've seen you and they know, oh, I'm not crazy, and this is just a neuropathic thing, do they get less bothered by the symptoms?
Well,
Because
yes
you know,
and no.
sometimes the unknown
Yeah.
scares people and it makes everything.
Right.
I've seen patients where they're in great pain, and once I say, oh, that's just a canker sore. Oh, okay.
Right.
You
Well,
know,
the difference is
find
the
out.
canker sore will, like, they're probably afraid that it be cancer, or so they reassure that it's nothing, but they also know that it's going to go away.
Yeah. Is this fair?
It's good if they know they're not crazy.
Right.
That's always good. But I think it's still disturbing, even though they don't think they're crazy.
How intense is the burning sensation?
The burning can be really intense.
Really?
Like you're scalding your mouth. It can rage. And so, interestingly enough, most patients wake up relatively pain-free. And that's disturbing too, because every day they wake up and they say, maybe it's the day where I'm not going to be burning. And then the burning reappears. And that's pretty typical, actually. Or if not zero, very, very low grade in the morning.
So they sleep a lot.
Well, they have a hard time going to sleep because of the burning, but they wake up pain-free. And that's also why I give them a lot of dose of medication at night, because it helps not only the pain, but it also helps them sleep, because they're sedating medication. Because if they get less sleep, chances are the burning will be more. So the burning is exacerbated by stress, anxiety, and all these other comorbidities. So if they're worried about being crazy,
Right.
it will definitely reassure them that maybe not dial it down. Dial it down. So capsaicin rinses, it sounds totally counterintuitive, because capsaicin is going to burn them as well. So in terms of compliance, it's pretty hard. If you suggest that they take capsaicin rinses and they know what capsaicin is, it's not going to go well. And again, that is somehow palliative. The result is not something that lasts. But they do work. They do work. So if they can get through having even more intense burning for 2-3 weeks, well, that's definitely something that can be explored, and then they'll have to continue. They have to continue. If they stop it, the benefits will go away. But if they continue on a regular basis, then the effect of capsaicin will not be felt as burning. Because here they're talking about vanilloid receptors, but also there is a train of thought that saying they actually destroy the C fibers. And the reason why the neuropathy comes back after a while is that the nerves regenerate. So you have to keep rinsing. But again, it's very safe, even if they swallow it. I even read an article about actually ingesting capsaicin. And so the problem is that some people develop gastric ulcers, not ulcers, but gastritis from the capsaicin. But with the rinses, you swallow very little, so there's no risk of. That's another thing also. Patients are afraid that the burning is going to hurt them or cause cancer. I have a lot of patients who, because these diseases are so weird, they're afraid. So a lot of it is palliative. Because for a lot of people, even gabapentin with clonazepam cannot be titrated up enough to really bring the disease to zero. So it's a fine line. If you bring the medication really high, then they are incapacitated and debilitated by the side effects of the medication, and they may have no more burning, but they don't like it because of the side effects of the medication. If you don't bring it high enough, they have more burning, less side effects. So it's constant balance. So I tell patients that we may not get to an ideal situation where they have no side effect and no burning. And so I rely a lot on these palliative solutions, which again are not perfect, and they might work better for some people than others. And I always encourage them to try things. And if they find something that helps them, use it, let me know so I can pass it on. Probably the best one that they tell me is water. These people constantly sip water, cold water, all day long. But ice cube, they also use a lot. They pretty much always have a type of food that makes the burning worse. For some people, it's citrus. For some people, it's mints. For a lot of people, it's spicy food, which is kind of, you know, the capsaicin rinses versus the spicy food. It's really the same thing, right? But the capsaicin rinses, you use them all the time, like several times a day for several weeks. And then they start having some benefits. But if you use one time and it's a spicy meal, it's going to make things worse. I put down here counseling, and we'll come back there later. But is there any questions on the palliative treatments and the treatments in general?
Is there any like holistic treatments out there, acupuncture, anything?
It hasn't really worked very well, acupuncture. If the patient wants to try, I always encourage them to try if they want to, because acupuncture is very safe. And there's always a 20% placebo that I'm trying to harvest by doing something that the patient is really into, because compliance is a problem. So if they're really into something and they believe in it and it's not a bad thing, it's not going to cause any problem, then I encourage them to try. Try it for 3 months and see how it goes, and if they report benefits, by all means, continue.
Any
who am I to say?
homeopathic, any herbal?
Same thing. You know, I'm not a specialist in homeopathy, but homeopathy is basically minute concentration of almost non-existent concentrations of substances, so it's not going to have negative effects on people. And if they want to try and it works and it's safe, I'm all for it. You know, I tell them, I send them to somebody who knows what they're doing, as opposed to somebody who's going to give them crazy things, because that happens too. They fall victim to people who promise great treatments, but it turns out to be something really negative. I mean, something really dangerous. So if they're interested in alternative medications, I have my sources and I send them either to reputable websites or reputable practitioners, reputable people in the community. It's also really important, because it's a neuropathy, it's also really important to keep the patient having practice relaxation techniques, because stress will increase the pain, anxiety will increase the pain. They will tell you, when I'm stressed, it's worse. When I'm anxious, it's worse. And that's one of the reasons why they thought it was a psychogenic disease in the first place, because people would report, you can't see anything in the mouth, and people report that when they're stressed and depressed, and anxious, the pain is up. So the normal conclusion in those days was to believe that it was just a psychiatric disease. But it's important because of all pain disorders, all neuropathies increase when you have stress and anxiety, that you do keep them engaged in pleasurable things. Because when you engage in pleasurable things, you have a release of neurotransmitters that is going to block the pain. So it's very difficult for them. So you really have to make a point, put it in the prescription. What do you like to do? And I need you to do this 3 times a week. Not just like do what you like to do, but it has to be part of the plan. They have to make an effort to do this 3 times a week. I had a patient who said, I love belly dancing. And she got back to belly dancing, and she was very happy. She still had the burning, the clonazepam helped. She still had some burning, but at least her quality of life was so much better. Because you have to, basically it's quality of life. It's also good that the patient feels like they have some control over their treatment. It's not just, I'm coming to the office, I get a prescription, I take the pills. I have a responsibility in this. I'm going to do this, 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 in addition to taking the pills to make myself better. So if they take control over their syndrome, their disease, it will be better in the long run. And that's also good for any kind of neuropathic or chronic disorder.